Welcome back to Living Local. Are you or someone you know struggling with anxiety or depression? Well, there's now a safe, effective treatment that doesn't involve medications. Transcranial Magnetic Stimulation, or TMS, is making a difference for people in the Quad Cities by helping to rewire the brain, tackle pain, and get life back on track. And here to tell us more about it is Dr. Rich Whitaker, CEO of Vera Community Mental Health Center, and Dr. Henry Emerle, Medical Director at Vera Community Mental Health Center, which is also the segment sponsor. Thank you so much for being here.
You're welcome.
And
welcome.
I'm so excited to talk about this because it's just groundbreaking, isn't it?
Oh, absolutely.
So tell us a little bit more about TMS and exactly how it works.
Oh, I would love to. So TMS is a safe, non-invasive treatment for severe treatment-resistant depression. So we're talking about depression where someone's maybe tried 2 to 4 medications and got no benefits, or they couldn't tolerate the medications either. And this treatment just uses a high-powered magnetic coil that sends rapid magnetic pulses to specific areas of the brain. When we're treating depression and anxiety, those areas are the dorsolateral prefrontal area. And we send these pulses, and that in turn activates those areas of the brain and lifts them out of the depression, essentially. And then we see downstream effects where other areas of the brain are also lifted out of their depression as well.
Mm-hmm. Wow. Now you say that it's mostly, who would be a good candidate, I should say, because you mentioned that those who maybe don't respond to some of the medications, right, would be a good candidate?
Absolutely, yes indeed. Anybody who's tried 2 to 4 medications and either didn't respond to them for anxiety or depression or just had intolerable side effects would be an excellent candidate. And this treatment is completely non-invasive. Unlike electroconvulsive treatment, which induces seizures, this does not induce seizures. The most common side effect of this treatment is just achiness right at the site of treatment.
Oh, okay, okay. So let's go a little bit more in depth about what a person can expect when they come to Vera for treatment.
So, you know, they're going to come every day of the week for 5 days a week for about 6.5 weeks.
Okay.
And they're going to basically go right into a spa-like room where they have a nice comfortable chair. There's a magnet that looks about like the shape of my hand that just kind of sits on your forehead. I was the test patient.
You were.
for some of the first ones that we did, just to see how it feels and to let people try it. And it feels like it's tapping on the inside of your skull.
Oh,
that's basically the sensation. And you hear this clicking noise when it happens, kind of like an MRI.
Okay.
But you know, it really wasn't that uncomfortable.
Yeah.
And people will be done in about 20 minutes.
Oh.
So it's a very short, some pulses on, then they wait a little bit, then some more pulses.
Okay.
And anyway, about 6.5 weeks, and that's what it's like.
Okay, okay. Any side effects? You mentioned a little bit of pain on the side of the head,
it's
right?
just really achiness at the site of treatment. And one thing I want to mention about that is usually within 2 weeks, the achiness resolves. People, adapt to it, so they don't even notice that. And it's non-invasive, no anesthesia is required. People just can come in by themselves, drive themselves home. They don't really feel off in any way.
They don't have to sit around the waiting room and wait or anything like that.
Exactly,
Yeah.
and it's remarkable. It's been available with us for the last 5 years. We've treated over 200 patients with this method, and we've seen success.
Yeah, let's talk about some of those results and the progress that you've seen from patients.
Well, I can tell you that our front desk staff are probably the ones who notice it first, because they notice people are different when they're coming in.
That's true.
They were looking down, depressed. Now they seem to be a little brighter. They talk more. They share more about their lives.
Yeah, yeah.
And 84%, the latest stats show that 84% are actually getting better.
That's amazing. That's a big number.
And I would love to give you a contrast with if someone took the next medication up after taking 2 to 4 medications, there would be more like a 12% chance it might even help them versus TMS, which gives 84% chance. And we've been doing it the last 5 years. We've treated over 200 patients with
Is this covered by insurance?
It is. It's covered by all the major insurances. It's covered by TRICARE, by Medicaid, Medicare. All the insurances cover it.
Okay. And so what's the process for someone with major depression to get evaluated and start this TMS treatment?
Well, I'll tell you what, it's really easy. Just call up Vera French.
Okay.
They start with an evaluation with Dr. Emerle or one of our nurse practitioners. They then will go through a mapping process, which basically finds the right spot, exactly the right spot for you to do the treatment.
Oh, because it's different for everyone.
It is a little bit different because everybody's a little different, you know.
True.
And then it's basically getting started right in with treatment, but. It's super easy. We try to make it easy so that people don't have a problem getting in, and no barriers.
Right. Now, can this be used to treat other conditions besides depression?
Well, absolutely. It's FDA cleared for treating obsessive compulsive disorder. Also FDA cleared for smoking cessation and for chronic migraine headaches. And there's active research happening for post-traumatic stress disorder, for chronic pain syndromes, fibromyalgia. It really is likely to be the future of psychiatry and pain medicine.
Yeah, it sounds like it.
Right now, not too many insurances will cover some of those other indications.
Yeah.
But major depression, we're good on all of them.
Right. Well, it's totally groundbreaking. I mean, it's so great that this is here for folks here in the Quad Cities. Thank you for coming in and talk to us about all this new technology that you guys have at Vera French.
You're welcome.
Thank you.
All right, again, this segment was sponsored by Vera French Community Mental Health Center. And if you want more information on TMS treatment and other services Vera French provides, go to verafrenchmhc.org, and we'll also have all those details posted on ourquadcities.com.